Welcome to the Independent Advisors Podcast, where we dive into the world of stocks, tradable markets, and financial planning with Jessup Wealth Management's Chief Investment Officer, Mark McEvely, and CEO, Matt Jessup. You'll hear tips, tricks, and strategies to address your financial well-being, and most importantly, conveyed in a way that everyone can understand. Here are your hosts, Mark and Matt.
Welcome to episode 273 of the Independent Advisors Podcast, where Mark McEvely and I, Matt Jessup, bring you everything you need to know from the past week in the world of financial markets and financial planning. This week, we are deviating from our normal schedule to welcome Chad Hooper as a guest today. Chad's the owner and founder of Medicare for You, where he helps individuals prepare for and get set up on Medicare. Chad, welcome to the show.
Nice to be with you today. Thank you.
You have a great track record with us. We've referred individuals to you in the past. You've done a great job for them, and I welcome you to the show. And I think you're going to provide some good education to our clients.
Great.
Before we get into the discussion, let's quickly review the month-to-date and year-to-date performance of the major indices that we track. This data is from Y-Charts and is as of the market close on October 16th. S&P 500 index for the month is up 1.4%, year-to-date up 22.5%. Dow Jones Industrial Average for the month up 1.8%, and for the year 14.3%. NASDAQ Composite for the month up 1% even, for the year 22.4%. The iShares Russell 2000 ETF that tracks the small cap index for the month is up 2.6%, year-to-date up 13%. Vanguard FTSE All World ex United States ETF for the month is down 2%, and for the year up 10%. Switching over to the bond market, the 3-month Treasury rate sits at 4.72. 2-year Treasury rate sits at 3.93, and the 10-year sits at 4.02. Quick comment on bonds. I want to remind listeners and viewers the Fed meeting is coming up in a couple of weeks. A lot of anticipation of another potential quarter-of-a-point rate cut. We'll see what happens on that front, and we will bring that news to you. So pivoting back to our guest of the week, Chad, one thing I think that our listeners and viewers are going to be blessed with is kind of the timing of the year of your visit to the podcast.
It is the season.
It is the season. This is your busy season.
It is the busy season, for sure.
So before I have a list of questions that I think are going to be very educational for our viewers and listeners, why don't you just spend a minute or two and talk about what you do for a living, the business you created, your experience, and kind of educate them on your background.
Yeah, great. Thank you. So I've been in the industry for about 25 years in terms of benefits, and then for about the last 12, 15 years in specifically Medicare. So I've worked primarily on distribution of working for insurance carriers, and then migrated over into the independent side, where I provide a lot of consultative education and advisement to individuals for whatever their needs might be relating to Medicare.
And I know there's just so many moving parts. Obviously, there continues to be changes to that system, and I'm sure you've learned and pivoted through the years, which is why I think you bring a really good breadth of knowledge. So let's kind of transition. We have a lot of listeners in the podcast that are pre-retirement, that have a lot of anxiety about Medicare. So why don't you just start with the basics?
Sure.
What is Medicare, Chad?
Yeah. So Medicare is a federal program designed primarily for people 65 and older. We often know people with disabilities, people with end-stage renal disease, or people with ALS under 65 can also qualify for Medicare.
Yes. And so, how does one apply? Everything from how far in advance, how can they learn what that cost might look like?
Sure.
So just kind of start with, how does one apply for Medicare?
Sure. So we'll talk a little bit, first of all, about just some of the basic foundation of it.
Please.
Okay? So majority of people are going to get Medicare Part A upon turning age 65. If you become disabled, you're going to get that after 24 months of disability. You're going to get Medicare Part A, and you'll be enrolled in Medicare Part B. Okay. We're starting to see more and more people, they're deferring a little bit later because they're retiring later. So they'll wait to enroll. They'll get the A, but then they won't take the B until maybe 67, 68. And they're going to want to look at that probably about 3 to 4 months prior to retiring. Okay. So that's when they're going to need to replace their employer plan, if that's what they're being covered on today, and get that plan that they've earned on the Medicare side of things.
Just to jump around just real quick, because we get this question a lot, and maybe you can clear the air on it. Let's say that you are an individual who turns 65 years of age, but you're still working. Could your employer at that time force you to go on Medicare and go off the employer plan? Can you educate our listeners and viewers about that common question?
Yeah, technically, no. They cannot force you to do that. If you're a full-time employee, you still have the eligibility as every other employee, and they can't discriminate against that because you're age 65.
Okay, good to clear the air, because we, as you can imagine, we get that question a ton.
I'm sure you do.
I'll let you continue, and you can feel free to go down the path of how one applies for Medicare. You can talk about how the premiums work. I'll kind of turn it over to you, Chad, on the basics.
Sure. So with everything that's happened over the last 4 or 5 years here, the best way to go into applying for Medicare Part B is really, you can do that online.
Okay.
You go to ssa.gov, Social Security, and you'll file on there, and then they will then roll that over to Medicare, and they'll send you a brand new red, white, and blue card that'll tell you your effective date for Medicare Part B.
Got it.
Okay. Now, you can also go to the Social Security office in your local county and do it in person as well.
Are those by appointment only, Chad, or can you just go and just kind of wait in line, quote unquote?
It's typically going to be wait in line.
You know, it's interesting. We still have, I'd say, a fair portion of individuals that are nearing retirement that just aren't comfortable creating those accounts on the ssa.gov website.
Yeah.
And that prefer to go in person. And I still see more than people would expect that go in person and don't want to set up the accounts online. And I see both sides of that.
Real quick, I
Please.
just want to say, I think that's the problem is that, I always like, when people turn 65, I always like to say, congratulations, because you've earned the right now to spend your time doing what you want to do, whether it's family, grandchildren, activities, traveling, whatever it might be. And people they have so much, like you're saying, that they're very nervous about what comes next. And I always say to them, if you talk to a good advisor, let them do the worrying for you. It's much easier than people realize, but most people, they want to make sure they know everything, and they get so overwhelmed with the information, you'll get lost in it.
That's actually well said. And there is, just as you said, people are waiting longer. I see another subsection of people that are retiring earlier, and a lot of these individuals are either on some sort of retiree continuation health insurance plan, which tends to contain an elevated cost for them, or they go to the healthcare exchange, also tends to have some elevated cost. And they're looking forward to 65 because they're going to save a ton of money.
Absolutely.
Right?
So when you go on a Medicare, typically your Medicare Part A is going to be at zero premium. You're not going to have any cost for Medicare Part A.
And explain what Medicare Part A covers.
Yeah, Medicare Part A is going to cover your hospitalization, it covers skilled nursing care, things like that, more facility-based.
Got it.
Yep. And then Part B is going to cover like doctor's visits, x-rays, durable medical equipment, things outside of the hospital for the most part.
You're perfectly right on track with the agenda that I kind of put together. Like, Chad, I could tell you do this obviously every day. And I think you break it down in very understandable terms, because there's just so much, I think, not uncertainty, but just so much unknowns for retirees as they approach.
That's right.
There's so much misinformation, I think, on the topic. So maybe let's transition about kind of coverage options.
Sure.
Because this is where I think most people get confused by, because especially you see all these different commercials, right? All these different advertisements, and people don't kind of know, well, which way do I go?
Right.
So let's take a step back. We'll kind of still stay at kind of the 1,000-foot level. Let's kind of talk about, the Medicare supplement or the Part D. I'll kind of let you start where you think makes sense for education.
Sure. So when you become Medicare eligible, I first want to also state that, you have to pay your Part B premium. Your Part B premium is going to be $174.70 for the majority of people. based upon income level.
Got it.
Now, that's going to change in 2025.
Okay.
It's projected, it has not been announced yet, but it's projected to go to about 185.
Okay, so
that's
that's
what they're predicting.
It's going to go up.
It's going to go up.
Okay.
Absolutely. Absolutely. So when you become eligible for Medicare, it's very important to know a couple of things. Based upon plans that are available, you see these commercials, like you say, that say zero premium, you get all these additional benefits. What people really need to understand as well is that the Medicare supplement piece, that's a great product. It's standardized. So if you have a Plan G is the same with every insurance company. There's no variance on that. Now they might put like a little thing like an exercise benefit or something like that might be a little bit different. But for the most part, a Plan G is a Plan G.
So if one's offered by XYZ insurance company and one's offered by ABC, so you can kind of hear it on the Independent Advisors podcast, those for the most part are uniform.
They are uniform. That's right. The thing you want to take into regard with that is a few things. First of all, is that when you become eligible for Medicare, it's guarantee issue. So if you have terminal illness or you have a bunch of a lot of medical conditions going on, you're in.
They can't deny you.
They cannot deny you. That's correct. Right. The problem is that if you go into the other, which is an Advantage plan. Let me back up one point. So with the Medicare supplement, then you need to enroll, or you don't have to, but you should enroll into a Part D prescription drug plan.
Yes.
Because if you choose not to, upon being eligible, you can be assessed a 1% penalty of what's called a base rate. So the base rate, for easy numbers, let's say it's $35 for 2025.
Okay.
So you're penalized 1% of that $35 for every month that you're not covered under Part D, and that is going to go for the rest of your life.
That's substantial.
It's substantial, yeah.
And see, I think what happens sometimes is you have individuals that might be, say, very healthy in their mid-60s. I don't need that.
That's right.
Right? And then all of a sudden you get around to your 70s, some ailments start coming up, doctor starts writing you scripts, and you're like, oh my gosh, I didn't know about that.
Yeah. Yeah. So
Right?
it's important that people are educated and understand that they need to have that. The nice thing is locally, there are plans for Part D that actually have a very, very low premium. So if you're not taking a lot of medication, it's not going to be that cost prohibitive to enroll in one and feel like I'm not really getting anything out of it.
That's a huge point.
It is huge. Yeah,
That's a huge point.
Yeah.
So let's just stay on that topic just a little bit deeper. Let's say that an individual considers themselves healthy and they take more of a lighter prescription D program. But then say 5 years later, some ailments come up and they want to switch because the doctor is starting to prescribe some medicine.
Sure.
When are they able to switch plans?
Right now. This is the annual enrollment period. So starting just on Tuesday, on the 15th of October through December 7th is the time to make those kinds of changes.
Got it.
Okay.
And that's when a consultant like yourself, you would kind of have confidential conversations or meetings with these types of individuals. And then that's when they would confide in you and, hey, this is my current situation. This is my health. This is my prescriptions I'm on. Hey, Chad, what do you think the best plan is for me and my spouse? Is that a correct assumption?
That's correct. And that's the other thing is that on the supplements, what you'll see is that what I recommend is that there's a lot of detail out there anymore that you can look at historical data of increases. You can find out what the ratings are. You can find out how many people are enrolled in that plan on a national basis, how long it's been in effect. So you can take a look in that to get a feel for like, there's going to be increases every year on that, but to try to get a sense for what the average might be.
Correct.
The other thing is if you have a husband and wife, they often feel like, because I'm on company XYZ, my wife wants to be on company XYZ. And that's not necessarily the best way to look at it. But on the supplements, if you both enroll in a supplement, and they're cost appropriately, or they're advantageous to both enroll. Often, a lot of the companies offer a household discount, so you can get an additional break in the premium based if you're both enrolled with the same company.
And I'm sure an individual like yourself is going to look at that math, right? They're going to look and say, okay, this individual has, as of today, these type of health needs. The significant other has these type of health needs. So it either could or could not make sense for them to be on the same plan, even with that discount.
That is correct. Yeah.
Yep.
Absolutely.
I think that's great. And I think there's just a lot of unknowns for individuals because they see these commercials again for Part D and what does that mean and who do they talk to?
Yeah.
And that's why I like referring individuals to someone like yourself who can be independent, who can look at their situation and kind of guide them appropriately. Someone who does that day in, day out.
And it's all case by case basis. You know, you really have to look at each individual very differently based upon, first of all, what you know, you always want to look at, you know, if you're on a supplement, you can go to any Medicare provider in the entire United States. So if you want to go to MD Anderson for cancer treatment, you're going to be able to go down there.
That's a big point. So take a step back. So let's just assume that, God forbid, you were diagnosed with a serious ailment of some sort, and you're not comfortable with, say, the local advice or procedure, having it done there, and you want to seek treatment elsewhere. How does that work?
Yeah. So on the supplements, any Medicare provider in the United States you can go to. As long as they accept Medicare, you're going to be able to use your supplement.
That's a big deal, and I think that's not commonly known.
It's not commonly known. And for people that travel, you see that a lot of times with snowbirds.
Yeah.
You know, but the pivoting over to the Advantage plans, a lot of those companies are starting to have bigger networks, more like national networks. So they're kind of filling that a little bit. So
To try to compete.
Right. That's right.
How does it work, Chad, in regards to state residency? Does that play into when you're talking to a client and you're advising them? You know, it's very common that some of our clients retire to warmer climates.
Sure.
How does that play into when you have those annual conversations?
Yeah. The way that it should work is that if you move into a territory, let's say, for example, the Medicare supplement should carry with you through anywhere you live in the country.
Okay.
But the prescription drug plan you're covered on, those are typically, they're filed by county. Okay. So what could be here in Montgomery County might be different than what it is over in Greene County.
No, keep going.
So then you file, when you make your address change with Social Security to move there, it triggers what's called a special enrollment period. So from that point, you have 60 days to enroll into the plan that's available within the service area in the county that you're moving to.
So what's very important is if, you know, individuals work with someone like yourself, it's vital and very important that if you do move, they got to reach out to you so you can help advise them on what that that Part D change will look like.
Correct.
Because it's locally, geographically based.
Correct.
Interesting. Yep. I did not know that.
Yeah. So the plans will vary around the country, but most Part Ds are filed in all states. There just might be little variances
between the counties.
Yeah.
So anything statewide, Chad, that you would like to educate listeners and viewers? There might not be. I'm just double checking.
Yeah, statewide can vary there. You're going to really see the differences in that in the Advantage plans.
Yes.
So if we pivot over to Advantage plans, let me back up one step. So on the supplemental plan, the way that the supplemental plan works is that Medicare is going to pay 80% of all your claims. Okay. Now you do have a deductible for Medicare Part A.
Yes.
Okay, and you have a deductible for Medicare Part
B.
Okay. But most of the supplements, they'll cover your Part A deductible, and you still are going to have to pay your Part B. That's $240 this year. It's expected to go to $250-ish for 2025.
Okay.
So the nice thing about a plan like that is you pay a monthly premium just like your car insurance. But then after you pay that deductible for Part B, and remember, it's only for Part B services.
Yes.
Once you pay that, you have 100% coverage the rest of the year.
Love that.
Yeah,
Love that.
That's a big deal, especially somebody that's, if you have somebody that's utilizing a lot of care, it really could fall into their favor to pay that premium and be on that supplement, because in the long run, they're gonna come ahead on that.
Yeah, and so what I kind of see is this situation that as, let's just assume someone is going to take on Medicare right at 65. Someone like yourself is really assessing, okay, based upon the health profile of this individual and what they've shared with me, they may or may not be right for a Medicare Advantage plan.
That's correct.
They need a Part D prescription coverage, but the beefiness of the plan is going to depend upon that client's current health profile.
That's right.
All correct. Okay. I think also kind of taking a step back, let's maybe go down the road of later in life. There is a lot of misconceptions about care. Like, let's say that we have something in this world called assistance with adult daily living activities, or ADLs. Okay. For people that might not have heard of ADLs before, explain what that means, if you could. And in addition, walk down the path that if someone starts to need some care, what Medicare covers and what it doesn't, because I think there's a lot of misconceptions, and I think you could clear that up for them.
Sure. So ADLs are going to be things like, are you able to feed yourself? Are you able to, they call it toileting.
Yes.
Toileting yourself. Can you transfer yourself?
Yes.
Things like that if you're not capable of doing those, you need some assistance on.
Correct.
Yeah. So on some of those, you're going to be able to get some coverage on Medicare on some of those benefits. Where you really have to be careful is when people get into like a assisted living, or they get into like a long-term care where they need full-time care all the time. That's really going to be more of a policy for long-term care. That's not really going to be a medical insurance. Now, they're going to pay your claims when you need care and pay your prescriptions, but you're at a different level of care.
That's right.
Yeah.
And there's a period of time. Is there a period of time that, let's say that you start to need some help? Is there a period of time that Medicare would pay for any coverage in a facility, or is it from day one, they'll pay for the doctors and the prescriptions per se, but your actual care, they won't pay any of that? What does that look like?
Yeah, so most of it, you can get some in-home health care. Okay, and most of the plans are going to cover that at no cost.
And most people want to try to stay in their home if they can, I see.
Absolutely.
Right?
Yeah, most people, if they can, they want to be home.
Yeah.
For sure.
How about anything else along that same wavelength, Chad? I know you see a lot of questions come your way. Besides kind of that later on in life, what are some of the other topics we haven't discussed that you tend to get a lot of questions about?
Yeah, this is big. The Medicare Advantage plans, as I said, kind of how that supplement works. When you go into the Advantage plan, you're completely transferring all the risk over to a private insurance company. Okay, so Medicare is not involved anymore. You have to have Medicare Part A and have Medicare Part B, but the insurance carrier is responsible for all of your claims. Okay, so what you have to be careful on that is that if you see some of the stocks for some of the healthcare companies, they're kind of, so what's happening is we're seeing a lot of utilization in those claims. And what happens with that is that in 2025, we're starting to see what we call benefit degradation. So some of those benefits are starting to go up a little bit, and they're starting to take a little bit out right now.
Interesting.
Okay? Yeah. So with those Advantage plans, they give you things like vision, dental, maybe hearing on some of them. A lot of them are offering exercise benefits.
No, yeah,
So
I've seen a lot of clients tell me about that.
Silver Sneakers is kind of the big brand name that everybody's aware of, but all of them typically are going to have that in the Advantage plans.
Got it.
Now, the other thing, we started to see a pretty good trend of like a flex card that people could use for like vision, dental, or hearing.
Okay.
That's starting to dial back a little bit. But the other big thing, and people need this more than ever, is that some plans are offering an option where you can enroll into, you may be able to get like a food or grocery benefit of maybe $50 a month, $600 a year towards groceries. Or maybe it's going to be $50 or $150 a quarter that you can use towards maybe utility bills.
Interesting.
Yeah, so they're doing, so that's obviously a lot of marketing in that. But what they're holding the insurance carriers liable now for is that they're going to have on some of those supplemental benefits, they're going to have to report some of that utilization into CMS. So what we've seen is that there was one of the companies that had a very, very rich dental benefit here in 2024.
Okay.
And what they realized when they looked at the numbers, not that much utilization was going into that benefit. So they degraded that down quite a bit. So that looks very negative. But what the other side of it is that it wasn't being used as much as people might think. So you'll get some resistance because they cut it back. So for that person that was using it, they're going to kind of get a feel that because the bulk of the group is not really using that much of a benefit. So there's no need to have that benefit is how they're seeing that.
As you've kind of seen the Medicare Advantage market, and my perception is, and I want you to confirm this, that it's grown over the years. Is that a correct perception?
It sure has. Yeah.
What's your kind of, thoughts? And I'm not doing this to put you on the spot necessarily, but, what's your thoughts of kind of Medicare Advantage, the growth that you've seen? Are you seeing clients overall kind of happy and utilizing those types of plans? And I have no, hidden agenda when I ask you a loaded question like that. I'm just truly curious to see what your thoughts are.
Yeah, there's several things that have driven the increase, and that's going to continue. The projections are continuing to go up. I think there's several variables there. If you're going to pay $150 for a Medicare supplement, so you're going to pay $1,800 a year, and you're really not going to the doctor. Okay, I could go into a zero premium or very low cost Medicare Advantage plan and keep that in my pocket.
Interesting.
And what I often tell people is if you can be in a mindset of saying, I was going to pay $150 for that, then I'm going to pay another $30 a month for a prescription Part D plan, right?
Yes.
So you're $180 a month.
Yes.
If you put that in a side account.
Oh, smart.
And every time you used medical expenses,
you take it from that specific account.
And I would say a majority of people after a couple of years could probably take a nice vacation with the savings.
Interesting. And see, what's nice is as their health situation changes during open enrollment, you would advise them on, okay, it sounds like your circumstances have changed, Mr. Jones. We might want to consider switching that plan during open enrollment. Is that a correct way of assessing how you advise them?
That's exactly right. So a few things to keep in mind on that is that right around the end of September, first part of October, if you're enrolled in a Part D plan or you're enrolled into a Medicare Advantage plan, they send out what's called an annual notice of change, called an ANOC. Okay. And what that's going to provide to the individual is that's going to show them, and it's going to be a real thin document, and usually it's like wrapped in plastic, and a lot of times gets thrown out so people aren't aware. But we really want to advise people to take a look at that, because what it will show you is that what the benefit coverage was for 2024 and what it's going to look like in 2025. So they can have a little bit of familiarity with what the changes are going to be in their plan so they don't get any surprises the first of the year.
Interesting.
Yeah, so that's a document that has to be provided by the insurance carriers. The thing that I really try to advise folks on is that, it's risk. So you don't know what's coming, okay? But you typically have a pretty good feel for what your health pattern has been. You know how many times a year you're going to go to the doctor.
Yes.
Hey, have you been in the hospital inpatient? Have you had any outpatient procedures? So if you know or foresee some of those things may be coming up, the best example on that is going to be somebody if they were diagnosed with cancer and they're going to be having some type of a radiation or chemotherapy.
That's a great example.
So the plan, how that's going to cover that based upon a copayment or a premium could really drive what they're going to spend out of their pocket for that care, depending upon how many visits they're going to have. So, like I say, while you can't predict, you may be able to know a little bit now that could be coming, and I need to be thinking about that.
That's well said.
Yeah.
That's well said.
Yeah.
So, as we kind of, get towards the end of the education period, what else, Chad, do you think is important for our listeners and viewers to know, not only about, how you help individuals, but just how Medicare works? Words of wisdom.
Yeah. So this year, in 2025, as a result of the Inflation Act,
yes, sir,
we are going to see every Medicare recipient on a Medicare Part D plan, whether it's individual or it's part of your Medicare Advantage plan, is going to be a cap of $2,000.
Okay.
So people will not spend more than $2,000. So where we used to see it, that there was a it was a component of what people paid for their copay,
Yep.
and what the insurance company paid went up to what they called the coverage gap, better known as the donut hole.
Yes, and you hear about this. Keep going.
Yeah, and so in the donut hole, this year, most people are going to pay 25% of their medication in that phase of it.
Yes.
Well, now they're going to be capped at $2,000. So if you have
That could be substantial for some people.
for somebody that's taking, somebody that's taking Eliquis or something that's $500 a month. You've got the Ozempics, $1,000 a month. That's going to make a huge difference. The other thing that they're doing to help soften some of that for individuals is it's called smoothing. And what smoothing is it's going to allow individuals to enroll and opt in to a program that will help to offset what they pay initially, and it will spread it out as a payment program over 12 months.
Interesting.
That's brand new. Yeah.
I like that.
Yeah, so I think the most you can pay is like $167.77 or something like that, because that times 12 is going to be $2,000. So no matter what you're taking, how many you're taking, so you don't have to pay.
I think that's great.
Yeah, so you don't have to maybe pay, sticker shock.
Yeah.
Because what goes with that as well is that you're seeing in like what we would call tier 1, which are going to be preferred generics and generics. A lot of those are not going to be subject to any deductible.
Got it.
Okay. And
Yep.
a lot of those preferreds are going to be, or they also call them tier 6, like maintenance type medications are going to be 0 or very low copay.
Yes.
Okay. But when you get into the tier 3, which are going to be the preferred brand, the tier 4 are going to be the brand name. And then tier 5 are going to be more specialty type medications,
Yep.
injectables, things that you're going to take, that they're going to ship to you basically. A lot of those are going to be subject to deductibles, and we're seeing deductibles creep in on the 3, 4, and 5 medications.
Tiers.
The tiers for 2025. So that's something that is going to be a little bit more prevalent, and I think more so moving forward. The nice thing there is that with that smoothing, if people are having to pay that deductible and put that in there, they can help spread out that cost. But those other higher tiers are going more to a percentage versus a copayment, which is traditionally what we've seen in those.
Interesting.
Yeah. So a lot of changes on the Part D.
Yeah. I got one question that came to my mind that I should have asked you earlier.
Sure.
It's in regards to individuals that are on Medicare, but maybe have an outsized year on their 1040 or on their tax return.
Yeah.
Right? And let's say, for example, you have someone retire. I'm going to give you a very common scenario. Individual retires. Let's say they still have a mortgage on their house. And they think to themselves, you know what, it would be nice just to not have this payment anymore. And they might go into their investments, liquidate some things. They're probably at a gain to pay off that mortgage. I see this often.
Yeah.
And then all of a sudden, their Medicare premiums go up. And they're like, what happened here?
Yeah.
So can you take a step back just on this topic? And I apologize for going back into the podcast, but would you just educate people on why that happens and for how long it happens?
Yeah. So on an annual basis, they're going to look back at what the last 12 months have brought you and income-wise.
Yes.
And as I say, a majority of people are paying in 2024 $174.70 for Medicare Part B.
Correct.
But there's a whole grid that will tell you based upon if you're filing individually, if you're,
Head of household, married, filing jointly.
Exactly. And it will tell you based upon what that income is, what your Part B is going to be. So it's all preset in a nice form that you can pull up online, and it'll tell you based upon that, that's what your Part B is going to be.
So potentially, if you take too much taxable income, if you're able to control it in one given year, for the subsequent year, you could have elevated premiums.
You could.
And it takes time for that to reset. As they get that data from the IRS, it will go back down eventually.
Yes.
But it'll stay elevated until that resets.
If you have a big year.
If you have a big year.
Yeah.
I think it's important to throw out there. And I usually sit there and say, a lot of wealth management practices like ours, we have staff such as Taylor Ledbetter who can run some of those forecasting on where your AGI is coming in, your filing status, and what that might throw you into. And I know a lot of wealth management firms or accounting practices can do some other projections. I would just use this as a word of wisdom to our listeners and viewers that if you're on Medicare and you're going to be assuming a lot of taxable income in a given year, just be educated, not to talk them out of it. Just be educated to what those Medicare premiums will be for a little while, because it might shock you.
It might shock you, and the most important thing is you don't want any surprises down the road. You're better to know ahead.
Is it a good way of saying it?
It is. It is.
So as we get kind of near the end here, Chad, will you just kind of share how individuals can either get more education on these topics, how they could reach out to someone like yourself, ways to get in touch with you?
Sure.
What's your thoughts on that topic?
Yeah, a couple things. This is the time to take a look. And based upon some of those changes that have happened, the advisement is to really take a harder look. The industry is expecting much more activity than what we've seen over the last couple of years in terms of people picking up the phone, wanting to learn more, and what we call switchers.
Yes.
People that are already on Medicare, and because the plan's changing, they're going to make a change.
Yep.
What they're also finding out, though, is a lot of the other plans have changed as well. So it may not be that much advantageous for them to move plans because it might not be that much, better on the other side of the road.
Well said.
Okay, so but it takes the analysis to figure that out.
Well said.
Okay. I can be reached at 937-414-6578 or at Medicare for You LLC at Outlook is my email. So if you want to reach out to me, I'd be happy to give you some advisement and just some guidance on that. And that's really kind of what I would recommend. The one other thing I wanted to share with you is that talking about kind of what we foresee in the future, if I may.
Please.
Yeah. So there were some changes made that pretty much really is geared towards people with Medicare and Medicaid.
Okay.
Okay. It used to be those people could switch plans, 7-8 years ago. You could change plans 12 times in a year. You could be covered on 12 different plans. Then they scaled that back to move on a quarterly basis. Okay. So that has been a market that's been very attractive to go after because they know if there's something a little bit better, they've got something to enroll people in. Well, that's all changing. All those individuals are going to be subject to the same rules as the annual enrollment period, just like everyone else.
That's a big change. That's a big change.
Because if they make a move, they're going to go into what's called an integrated plan. So we have a plan here called MyCare Ohio, which was a demonstration program for Medicare and Medicaid, full Medicaid.
Okay.
And you're going to have to go into one of those plans. So they're going to have your Medicare and your Medicaid, and the independent agents can't represent those plans.
Very interesting. Yeah. And this goes into effect in 2025.
It does.
Interesting.
It does. But where we're seeing some changes too is in what's called the chronic special needs market.
Okay.
Now, chronic special needs plans are going to be geared towards people with diabetes, congestive heart failure, cardiovascular disease.
Okay.
And so a lot of those plans have different benefits in there that are going to be geared to help those individuals that have those kinds of chronic conditions. And those individuals qualify for a one-time special enrollment period that they can enroll into what they call C-SNP plan.
Interesting. Okay.
And that's expected to be kind of the next evolution, is we're going to see more and more of those C-SNP type of plans available.
A speciality given those ailments you just mentioned.
That's right. That's right. There's even plans for people with ESRD because until the Cures Act of 2021, if you had end-stage renal disease, you could not enroll into a Medicare Advantage plan. Well, that opened that up. So those people can enroll, but they're in regular Advantage plans. So, what's the coverage for dialysis?
Yep.
Do they have transportation benefit to get to those appointments?
Yes.
So those types of plans are going to start evolving, and we're going to see more of that. And it's going to be very focused on that individual's need to help them on that pathway and, reduce barriers for access to care.
And that's even more reason why an individual, would seek out some professional help with someone like yourself, because this is just, it's a tough road to navigate at times.
It is. And like I say, it doesn't have to be. And like I always say to people, I don't ever not tell people things to hide it from them. I just don't want to overwhelm people. So I try to keep it kind of very mapped out so that we don't get off the guardrails and you start going down all these other avenues and people just get lost so quickly. And, I work with people that are, doctors, engineers, very smart, bright people. But
Very analytical, very detail oriented.
But when it comes to this topic, they throw their hands up.
Yep. Hey, I want someone.
It's amazing.
I need someone to help me with this.
Yeah. Yeah, it's always surprising to me because I'm like, these people are smart people. Yeah.
And when Chad gave his email, Medicare 4 is the digit 4,
It is.
and U is the letter U. So just to throw that out there,
thank you.
For some clarification. A couple things before we sign off. I want to talk about the podcast just briefly. If you want to create your own podcast, we use Blueberry Podcast Hosting. It's a very popular podcast hosting site. You can go on there, use the promo code Jessup Wealth to get your first month of Blueberry Podcast Hosting for free. You can go on there. They have a hosting estimator on their website. Again, first month of your hosting is for free using the promo code Jessup Wealth, all lower cases. In addition, Jenna, our director of marketing, uses some AI software called Firefly's AI software. It helps us summarize our show notes, and you can use it to help note take and summarize meetings. There's a link in our show notes to purchase your subscription and make life a little bit easier. As we sign off, Chad, from episode 273 here, any final words you want to leave our listeners and viewers with?
I would just say take a good look at your benefits that you have going into 2025. Very important to take note of that. And there will also be what's called an open enrollment period that starts on January 1st and goes through March 31st, for which people can make a one-time change from a Medicare Advantage plan to another Advantage plan or a Part D plan. So that's something to keep in mind. That isn't marketed, though.
Yes.
There's a lot of rules around that.
Yes. But
if you change in January, it goes into effect February, and March, and April. So just something to be aware of. If you miss your chance now,
there's still opportunities in Q1.
There is.
I just think there's so many moving parts on this. I'm just thankful that there's individuals like yourself who can help clients navigate, I think, this very challenging topic.
Yeah.
I think your timing on the podcast was literally perfect with the time of year that we're in. So I very much appreciate the sacrifice of your time to be on the podcast and educate our audience. Chad, I really appreciate it.
Thank you, Matt. It's a pleasure being here today.
It was wonderful, my friend. So thank you, everyone, for listening to episode 273 of the Independent Advisors Podcast. Myself, Mark, Jenna, Aaron, Nick, Taylor, we all very much appreciate you listening, and we'll be back next week with episode 274.
Thank you for listening to the Independent Advisors Podcast. If you're interested in hearing more, hit the subscribe button so you can be notified every time a new episode gets released. Feel free to share with friends, family, and follow us on Twitter at Jessup Wealth, Facebook, and LinkedIn. Mark and Matt will continue to share beneficial information on these social media sites. Also, check out the podcast tab on their website. That's www.jessupwealthmanagement.com. There you'll find links to every episode of the Independent Advisors. Have questions or topics you want to discuss on the show? Message us on Twitter, LinkedIn, or send an email with the words questions and topics in the subject line to inquiries@jessupwealthmanagement.com. We'll talk about it right here on the podcast. Certain sections of this commentary may contain forward-looking statements based on reasonable expectations, estimates, projections, and assumptions. Forward-looking statements are not guarantees of future performance and involve certain risks and uncertainties which are difficult to predict. All indices are unmanaged and are not available for direct investment by the public. Past performance is not indicative of future results. This podcast is provided for general informational purposes only and does not constitute either tax, legal, or financial advice. Although we do go to great lengths to make sure our information is accurate and useful, we recommend you consult a tax preparer, professional tax advisor, financial advisor, or lawyer regarding your specific circumstances. Investing involves risk, including the loss of principal. No strategy can guarantee any objective or goal will be achieved.